Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. To best understand preterm labor and preterm birth, we should first look at how we define it. Preterm labor is regular contractions with cervical change prior to 37 weeks gestation. Preterm birth is delivering the baby between 20 weeks and 36 weeks and 6 days. This is the leading cause of neonatal complications. It increases the risk of NICU admission, respiratory distress for the baby, feeding difficulties, and temperature instability. Our most common cause of preterm labor and birth is infection. This can be urinary tract infections, genital tract infections, intrauterine or intra-abdominal infections like chorioamnionitis, or systemic infection. Uterine overdistension, so multiple gestation pregnancies or polyhydramnios. Preterm premature rupture of membranes where the water breaks early. This can also increase the risk of chorioamnionitis as well. Cervical insufficiency, where the cervix is shortening and dilating prior to the baby being term. This can also be structural abnormalities like with the uterus as well. Placental problems, so placenta previa or placental abruption. Also, placental insufficiency can cause a need to deliver early. Maternal medical conditions, hypertension, diabetes, preeclampsia. If she has a short interval pregnancy where she delivers and then gets pregnant right away, this increases her risk. If she's had preterm labor or preterm birth before or low progesterone, these are also risks as well. Maternal stress, physical or emotional. Lifestyle factors, limited prenatal care, smoking, drug use, poor nutrition, and then there can be fetal indications to deliver preterm, such as intrauterine growth restriction or fetal distress. For predicting, preventing, and also recognizing early signs of preterm labor, it's important that we evaluate for causes. The best time to do this is prior to pregnancy. If preconception counseling is an option, we can get a handle on things like hypertension and diabetes prior to pregnancy even occurring. We can also promote health and lifestyle modifications, so helping her quit smoking or get off drugs. If we suspect preterm labor, fetal fibronectin is a test that can help evaluate for this. It's the most accurate predictor with a negative result, meaning that there's less than a 1% chance that she will deliver within 2 weeks. Cervical length is another way to assess. So measuring the length of the cervix. If the cervix is less than 25 millimeters, this definitely has an increased risk of preterm birth. If the cervical length is greater than 30 millimeters, the likelihood of delivery in the next week is about 1%. So if the cervix is greater than 30 millimeters or 3 centimeters in the second or third trimester, it's unlikely that she will give birth prematurely. For a woman who has a short cervix, it might be a consideration to give prophylactic progesterone to help decrease her risk of preterm birth. And this is also used for women who have had preterm birth in the past. To recognize early signs of preterm labor, we would be looking for regular uterine contractions or tightening, dull low back pain, pelvic pressure, menstrual-like cramping, changes in vaginal discharge, or fluid leaking from the vagina. Oftentimes, these signs can be very subtle and can be mistaken for normal pregnancy discomforts like back pain and pelvic pressure. Nursing actions and interventions include IV hydration, treating the underlying cause, whether it's infection or if she has a cervix that's dilating and they can do a cerclage, or if she needs progesterone or whatever. Medications, so antibiotics, betamethasone to help promote fetal lung maturity and decrease neonatal complications if the baby's born early. And this is going to reduce the risk of respiratory distress syndrome for the baby. And then tocolytics are medications that can suppress uterine activity. This may not keep her pregnant for a long period of time, but it can kind of buy time for us to get betamethasone on board and help the baby's lungs develop. Nursing actions are largely going to be focusing on monitoring and assessment. So assessing contraction pattern, monitoring the fetal heart rate, evaluating cervical status. If the cervix is changing, that means she's in labor. Monitoring vital signs, assessing for signs of infection, and assessing for rupture of membranes. Our tocolytics are medications that will help decrease uterine contractions. And we can use the mnemonic, "It's not my time," to help remember what these medications are. So I is for indocin or indomethacin. This is a nonsteroidal anti-inflammatory drug. This medication should not be given after 32 weeks gestation because it can cause premature closure of the ductus arteriosus, which is very important for fetal circulation. But it also does work well to slow contractions down, so we could use it prior to 32 weeks. N is for nifedipine. This is also called Procardia. This is a calcium channel blocker, so we need to evaluate blood pressure prior to administration. M is for magnesium sulfate. Magnesium sulfate is a central nervous system depressant. It is going to decrease contractions, and it also can provide neural protection for the baby if the baby is born before 32 weeks. However, magnesium sulfate also can have the side effects of respiratory depression, and we need to monitor closely for signs of toxicity. So we're watching deep tendon reflexes, we're watching for respiratory depression, and we're watching urine output and making sure that her urine output stays above 30 mLs per hour. It's also important with this medication to have calcium gluconate on hand as the antidote. And then T is for terbutaline, and terbutaline is often used for non-reassuring fetal heart tracings in labor, but it also can be used for preterm labor to help the uterus to slow contractions down. It can cause tachycardia for the mom, so another time that we should know vital signs prior to administration. So to review, preterm labor is regular contractions plus cervical change before 37 weeks gestation. Preterm birth is delivery between 20 weeks and 36 weeks and 6 days. Our most common cause is infection. Other maternal factors include hypertension, diabetes, short interval pregnancy, structural issues, and lifestyle choices. Fetal factors include intrauterine growth restriction and fetal distress. Additional factors include preterm premature rupture of membranes, uterine overdistension, and placental issues. Our symptoms include uterine tightening, dull backache, and pelvic pressure. Management includes assessment and monitoring, so checking the fetal fibronectin, checking the cervical length, checking cervical dilation, monitoring contractions, and then monitoring fetal status and membrane status. Treatment will include IV fluid, antibiotic, betamethasone, tocolytics, treat the cause if we can, and be prepared for delivery. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.